Yesterday, British Columbia passed a really sad milestone. 1,000 people have now died of COVID-19 in BC. I want to share Whistler's condolences with the family and the friends of the people who have died of COVID-19 during this pandemic. I also want to share condolences to the family and friends of the people who have died of BC's other pandemic, the poison drug supply. This has been an extremely hard time for so many people in our province, and the hearts of Whistlerites are with you. In her press conference yesterday, Dr. Henry talked extensively about vaccination in British Columbia and the plan that is being carried out. Much thought and considerations has gone into the vaccination plan, as you can imagine. The approach is based on the highest risk people receiving the vaccine first. BC, like every other province, has a limited amount of vaccine arriving between now and the end of March. In fact, Dr. Henry expects that we'll have vaccinated about 10% of the population by March 31st, after which mass vaccination across the community will roll out. Everyone who wants the vaccine and is able to receive the vaccine will have access. But again, higher risk people will be first. Those working in healthcare, those at risk of getting COVID-19 and suffering from it. We won't approach herd immunity or community immunity until much later in 2021 at the earliest, which means we need to continue with our layers of protection for most of this year. Wash your hands, cover your face, remain physically distanced, go home if you're sick. At this point, BC is actually through the full allotment of our Pfizer vaccine, with more coming at the end of this week. And the Moderna vaccine is also getting to the end of its allotment. But we are getting a sense from the federal government, and Dr. Henry is getting a sense from the federal government, that those additional vaccines will be coming quicker as we move forward. I've been so impressed with the work that the federal and provincial government are doing together, and it occurs to me that this will really ramp up as we move forward, that it will move at scale, which will be a real benefit to our community and to the whole province as we move through the vaccination program. Dr. Henry was cautiously optimistic about our COVID case numbers yesterday, and wanted to just pass on that her view is that this is partly due to our great work over the holiday season. We took this seriously, we took her orders and her recommendations seriously, and the province responded. That flattening of the curve right now is unique. British Columbia is seeing results that not every province across our country is. So well done. That's good news. Just a reminder that vaccination will again roll out throughout 2021, and so that we need to keep our layers of protection up. Thank you for your time today. Take care of yourself. Take care of each other.